A very warm welcome to all of you in this interactive session of ours, where today we are going to discuss a very special topic with you. And the topic is Atonic Bladder. We generally talk with you various problems which are related to the urinary system, to the kidneys, but let's talk about the bladder today. The bladder is referred to as Basti in Ayurveda, and it is considered to be the sthan of Vayu over here. So when we talk about the normal bladder and when we talk about the normal urination process, which is also known as micturition, let us firstly understand how micturition occurs. As you can see in this diagram, the bladder, as the urine forms through the kidneys and it collects in the bladder, gradually the bladder walls, they keep on stretching, and once the urine is collected in the sufficient quantity in the bladder, the message from the stretch receptors, the receptors from the bladder wall, it goes to the brain, and the brain then sends the message which enables the bladder walls to relax, and once these bladder walls relax, we are able to pass the urine. So that is the नॉर्मल प्रोसेस ऑफ मिक्चुरेशन। आप सब लोग जो हमारे साथ जुड़ रहे हैं, मैं आपके क्वेश्चंस पे भी आऊंगा, लेकिन सबसे पहले 10 मिनट के लिए हम अपना एक टॉपिक ले रहे हैं, आप हमारे साथ बने रहिए। सो नाउ व्हेन वी कम टू द फिजियोलॉजी ऑफ एटॉनिक ब्लैडर, दैट व्हाई इट एग्जैक्टली हैपेंस। सो व्हेन वी टॉक अबाउट द फिजियोलॉजी ऑफ ब्लैडर, when bladder fills with urine and stretches out, it sends two signals to the spinal cord. One is the sensory signal that gives us the urge to urinate, and the second is the motor signal which enables our muscles to relax so that we can pass out that urine. And in normal circumstances, that is what regularly happens, and a person is able to pass on the normal urine. But unluckily, once the problems they arise, then this normal process does not carry on. And when we talk about the causes, there can be many causes which can result in a atonic bladder. The first cause, when we talk about it, it is neurological conditions pertaining to central nervous system, peripheral nervous system, or mixed ones. It can be due to spina bifida, diabetic nephropathy. Now this is something which is really very important. Diabetic nephropathy, neuropathy, and multiple sclerosis. These are some of the debilitating neurogenic problems which can cause a atonic bladder. Along with this, there can be injuries, there can be obstruction which can be due to enlarged prostate, pelvic tumor, urethral strictures. So all these things can cause a flaccidity of the bladder muscles, as a result of which the urine may not pass out. So when we talk about the symptoms now, these are the reasons which we just discussed, and these reasons then result in the symptoms. And when we talk about the symptoms of atonic bladder, they are really agonizing. There will be a urine spilling out of the bladder, which will be overflow incontinence. Then there will be a constant full bladder, and which can cause discomfort. There will be a difficulty in passing the urine, and since the urine is there, the residual urine is also always there in the bladder. So it can always be a cause of recurrent UTIs, urinary tract infections. Now there are many complications which can arise due to this atonic bladder. The bladder infections can be there, kidney infections can be there, kidney damage can occur due to the backflow of urine and causing hydronephrosis, and this can eventually lead to a kidney failure. In allopathy, there is not much that can be done in a patient suffering from atonic bladder, and hope it lies in Ayurveda. But before we move to the Ayurvedic treatment of atonic bladder, let's see what exactly is done in allopathy. There are non-surgical treatments which are there in the allopathy, and also there are surgical treatments in allopathy. And along with this, there are certain lifestyle changes where the patient is asked to avoid carbonated beverages and coffee and other diuretics. And along with this, catheter is inserted wherever required. The patient is also advised to wear certain absorbent undergarments like we see nowadays, the adult incontinence diapers the person is asked to wear. So it's more of a management than a treatment. And when we talk about a surgery over here, a suprapubic catheter is inserted. It is really very troublesome to have this catheter inserted. Then there is urinary diversion, where an alternative path is created for the urine to leave your body. So you can see that they are all so much problematic and inconvenient treatment. Then cystoplasty is also done in cases of incontinence of bladder. So despite so many choice of treatments that are available in a patient who is suffering from atonic bladder, there is no proper treatment that is available which can bring the patient out of this disease. So hope it lies in Ayurveda. And when we talk about the atonic bladder treatment in Ayurveda, Ayurveda believes that Apan Vayu, the Ayurveda, it believes that Apan Vayu is the Vayu which is basically responsible for the process of urination and defecation. And it is Apan Vayu Dushti which causes this problem. As a result, when a patient is to be given treatment for atonic bladder, it is the Apan Vayu treatment that is done for the patient. And when we do a Apan Vayu treatment for the patient, the treatment can be both with certain herbs and minerals as well as the specific Panchakarma treatment, the Shodhan Chikitsa, which is done for a patient suffering from atonic bladder. And yes, when we talk about the Panchakarma treatment, the Shodhan Chikitsa, the results are very much evident, because not just do these herbs increase the bladder tone, but at the same time these are herbs which act on the neurotransmitter levels, the nerves they are potentiated, as a result of which a person generally, when he or she starts with the treatment for atonic bladder, especially when we talk about the patients who approach us and where we start with the treatment for atonic bladder, we see a marked improvement right from the very first month itself in such patients. Now, if we talk about the herbs which are very good and the minerals, the first mineral over there, the organometallic compound, is Trivanga Basam. For the Indian patients and where the people they go for bhasmas, it contains a combination of Nag, Vang and Yashar, and it really works as a miracle in all kind of urinary bladder problems. But since most of our international patients, they prefer going for herbs rather than going for the organometallic compounds, so we are having certain special combinations over here for atonic bladder for our international patients. And the choice of herbs over there are Jamun, Syzygium scumini, which is also a fruit. The fruit is often used by us. Then the second is Punarnava, Boivia diffusa. That again is a very good herb for not just giving a tonicity to the bladder, but also for removing the UTIs which are resulting from the atonic bladder over here. Carrying on with the next mineral, it is Shilajit. Now Shilajit is something which is a world famous thing, and aphrodisiac, adaptogenic properties are there in it, and also something which improves the anabolism and reduces the catabolism in the body, or Rosina. So these were some of the things which are generally used if a patient is suffering from atonic bladder. Many a time when the patients they approach us and we guide them about the herbs which are really good ones for atonic bladder, they ask me for something which can be a combination and can really work on it. And if I talk about that combination, the combination is PTM5. Now PTM5, when I talk about PTM5, it is the herb of choice, it is the combination of choice for a patient who is having atonic bladder. And I'll try if I can show you PTM5 over here. मेरी कोशिश रहेगी PTM5 अगर मैं आपको दिखा पाऊँ. So as you can see on my background, PTM5 is an ancient combination, more than 5,000 years old combination, in which we added certain research herbs from our end so that it can really work miraculously in a patient who is suffering from atonic bladder and other urinary tract infections. So if any one of you is suffering from this disease, a atonic bladder or a neurogenic bladder, and you are tired of visiting here and there, and you have tried a lot many allopathic treatment, I would personally suggest you Ayurveda is something which you can really try, and believe me, the Ayurvedic treatments for atonic bladder, it gives a very quick recovery to most of the patients. So please feel free to share the details of the reports, the details of the medications that you have been taking on the number which is there on your screen. You can WhatsApp it to us, you can mail it to us, and our doctors, our team will be getting back to you in that case.